who had done MD, DM, PGIMA, CHD, Fellow Movement Disorders, UWO Canada, Senior Consultant Neurology in Asabara, Gurgaon, right now. So next over to Dr. Zoraban.
Yeah, hi everyone. Thanks for coming. I'm Dr. Saurabh. I think I have seen most of you, but still who don't know me. I've been working with Fortis. I've done my MBBS from KM, MD Medicine, and DM from PJ Chandigarh, and I was in Canada for movement disorder training. So the basic purpose is just to show kind of patients we got and what was their outcome when they were treated and they were leaving the Fortis. So basically, I'll be covering part of movement disorders and few videos of the general neurology as well. So what symptoms are generally pointing to a movement disorder problem, like tremors, shaking in the hand, gait and balance problem, slowness in carrying out activities, abnormal twisting of a body part, or any abnormal excessive body movements. So she's an elderly lady, came with difficulty in walking. This is how she presented to us. So as we can see, she cannot take even a single step without any difficulty, very short steps, quite handicapped by her disability, no other previous medical history. Walk towards me, try coming towards me. We can see the feet are stuck to the ground. Keep your hands free and try to walk. Come towards me. हाथ पकड़ के चलाओ, हाथ पकड़ के चलाओ. Come towards me. This is her after we did the CSF tap. This is 1 hour after the tap. So her quality of life improved significantly even after a simple CSF tap and a correct diagnosis. So it was quite rewarding. Only thing it needed was a good clinical judgment, and so before we could see, she could not get up, take a single step. And now with bare minimum support, minimum assistance, she is able to walk. And this is only 1 hour after the CSF tap. This is another gentleman, Parkinson disease, 8 to 10 years, quite disabled, inadequately treated. Tell me your name, sir. Okay. What is your problem? Quite slow, effortful speech. Okay. Quite stiff. Right hand in front, like this. Turn it. Other one, please. Now this one. Okay. Hand open and close. So the videos I'm showing is all of the Fortis work which we have done over the last 6 months to 9 months. Other one. Finger tap. Quite slow, stiff, wheelchair dependent. Okay, toe tap. Unable to get up, needs 2 people to lift him up from the chair. If you see, he's forward bended, knees are bended, quite disabled. Can't go there to the chair.
Do'stlar, bu Parkinson aytgan bitta kasallik, yurolmaydigan, badanni ushlamaydigan kasal. Buni operatsiya qilib,
Only with the levodopa.
operatsiyadan keyin
Only thing it needed was little bit tweaking and adjustment. And this is just 2 hours after levodopa.
u boshqa davlatlarga javob bergan, unda Indiyaga kelib,
Before he could not get up and walk,
Sandeep
at least needed 2 people to lift him up, but now he's able to walk.
Yurmaydigan
Though
odam
slow, but
yuradi.
with respect to the previous video, there is marked improvement. This is a 77-year-old gentleman case of Parkinson's. He had undergone DBS in 2018. So I'm seeing him about 5-6 years post DBS.
kasal.
How do you feel your speech is
DBS, deep brain stimulation apparat qo'ygan miyasiga.
So what has improved in your speech?
Well, initially I had a very heavy tongue.
Okay.
I couldn't talk or when I talk, people would not understand me.
But now it's better?
Now it's better.
Okay, can I see you walk? So considering 77, 5 years plus into DBS, he is quite
degan
doing
odam,
well without
yurol
medication. Back.
Mashallah, mashallah.
So hi Amit, how are you? He will be tell about. I'm good. So tell me, how are you feeling with respect to your speech?
Well, honestly, let me start from the beginning when I met Dr. Sandeep.
2018 operatsiya bo'lgan. Juda ham xursand.
Until I came here, and the way you have handled me is exceptionally professional.
So if you diagnose correctly, it's quite rewarding. And so this is one video where a young boy with abnormal twisting of the back. This is before treatment, where you can say he's almost bent like an arrow backwards, arching back.
Badani orqada tortish edi. Operatsiyadan oldin ahvoli bu.
This case was primarily handled by Dr. Sandeep, and this is him after treatment. So we did a DBS surgery for him.
Bu operatsiyadan keyin
This is him showing what used to happen before.
aytibdi, operatsiyadan oldin shunaqa ahvolda edim, hozir normal ahvoldaman. Bunaqa ahvolda edim, hozir normalman.
يعني حركات مثلا حركي وما عرفت يا الحالة اللي يعني اي لكن الوضعية يعني نوعا ما زينة يعني تعتبر اي اتمنى انه تحسن بالمستقبل يعني حركات اسويها مثلا استفادة هاي الحركة مثلا تنقذ الانحراف ارتاح.
Walaikum assalam.
A young girl
Oh, mara mahliyo.
underwent DBS last year early in Feb and March. This was her before treatment.
Bu operatsiyadan oldin mahliyoni videosi.
She is currently in India. We are just doing the fine tweaking. She is much better.
Mahliyoni ahvoli O'zbekistondan operatsiyadan oldin. Hozir qarang. Operatsiyadan keyin o'zgarishlarini qarang. Yes, I will speak about her. I will speak about her.
This is the family members telling about the condition pre-surgery.
Nasim Holov. Yes, yes. Hamma biladi bu kimda kasali.
This is her post-surgery,
Operatsiyadan keyin.
and I think this is within first week post-surgery.
Yes. Va operatsiyadan bir haftadan keyin.
Now come running.
Mahliyoni yurishlari.
It's hard to believe it's the same girl which we saw before. This is her.
Va mehmonxonada Appearance.
This is few weeks to months after surgery. So recently I got to know after the surgery she got engaged as well.
Yeah.
So Bakhtiar, if you want to talk about her.
I think my voice is too loud. Hello, good evening, everyone. My name is Bakhtiyor. So this patient was from Uzbekistan, and we called her to India and discussed with Dr. Sandeep Vesha. So we planned Dr. Sandeep Vesha and the team. They planned that DBS surgery for her. The surgery was quite successful, and the family was happy. This is the video after 1 week, I think, which Dr. Sandeep Vesha by himself record that video. So she is happy and she got engaged after the surgery when she went back to her country, and she's very thankful from Dr. Sandeep Vesha and team and Dr. Suhrab as well. Thank you.
This is a young boy unable to go to school because of abnormal twisting and jerking movements. This is him a day before surgery.
Yeah, she's back. Abortion.
You can see neck going back, not able to talk.
And does he have it in hands also? Yeah, there is one. Yes. He cannot. He properly. He has. With the right hand or left hand? With his hand and left hand. So ask him to do something with the left hand. Okay, can I Way is island, way is.
Van bitara kasal ahvollarni qaraysiz, qanaqa ahvolda operatsiyadan oldin ahvollari bu. Qo'l oyoqlari kontrolda emas.
So the medication was not working. It was quite generalized, so you could not give toxin. So he underwent the surgery, and this is him after I think 3-4 days after surgery.
4-5 kun operatsiyadan keyin ahvoli. Mashallah.
Şu an yok. Ziyan? İyice şu an.
He's off any medication. He started going back to school.
Maktab ketishdan boshladi normalni.
This is him about a week after surgery.
Bir haftadan keyin operatsiyadan. Xursand.
So I think it's quite rewarding if we, and this is him after, I think we took after about few months after the surgery when he had come for the second session of programming. So he started going back to school and relatively living a near normal life. So this is a video.
And also products and basically I was diagnosed by disease in 2012. Initially I had just tremor in my hands. Then that gradually it developed to loss of balance, and later stages I had 2 or 3 episodes of fall. Initially I was treated with conservative, which and initially the disease progression was very slow, but later on it was very fast. After that, somebody referred me to Kolkata. And ultimately, he advised me to be an NEUROSURGERY because of my drug-related dyskinesia. He contacted his senior and he also said to me, you should get your DBS done, which I agreed. Then Dr. Anurag Singh from Fortis, he is a batchmate, he said, go ahead and go to Fortis and get it done because Dr. Vash is a very good surgeon. Therefore, I opted for Fortis. And when I came here, I found it. It is a very good hospital with modern facilities. I got the DBS done on September 2023, and post-operatively, I am very fine.
So, Dr. Satyavlash, can you tell us pre-surgery and as of now it's about 4 to 6 weeks after the surgery? Every 90 minutes to 120 minutes. Now he's on only 1.5 tablet throughout the day. So I think in him it has made a remarkable difference. And sometimes when you do between the pills and the treatment, he was off walker, off wheelchair, only cane occasionally, tremor is hardly ever there. And his levodopa had significantly reduced from I think 16-18 pills to 8 pills. So the aim is medical management, Botox or surgery, whatever it is, it's a team effort. And if you choose to go ahead with the surgery, you have to have a good patient selection, good target definition. So I think it becomes mainstay in cases of severe refractory cases. Just shifting a little bit of gears from the movement disorder. So I'll just talk a simple case which was referred to me as an epilepsy. So epilepsy treatment depends on the type of seizure patient is having. You need to rule out mimics. You need to do sometimes video EEG and MR epilepsy protocol. Choosing a drug is important, right type of drug for the right type of seizure which patient is having depending on the male, female and the age. And then you have surgical options as well. But most of the times choosing the right drug, either monotherapy or combination, can solve up to 70 to 80%, provided you do not have any major tumor or lesion in the MRI. And then in cases of drug refractory epilepsy comes the role of video EEG and surgery. She was seen by me, referred as a case of seizure facial twitching.
Tight.
Very intelligent lady.
Tight. Open. Tight.
Initially, I thought she's doing by herself. She's making out or she's a non-organic case. I tried to distract, but it could not. And this is her after treatment.
We'll just ask you, how are you? You're feeling better? Yes. Okay. Do like this. Tap. The other one. Tight.
So this was not just epilepsy. This was not epilepsy. It was just some hyperexcitability of the facial nerve due to low calcium. So sometimes what is referred is not.
We'll just ask you, how are you?
Sorry. I think this video is in Hindi. I think Hindi or English mix. He had seen many big institutes in Delhi NCR not getting relieved.
पानी आता है और आंखें लाल हो जाती है उस ड्यूरेशन में।
लेफ्ट आई से भी पानी आता है और लेफ्ट नोस्ट्रिल से भी। राइट साइड से कोई दिक्कत सर?
राइट साइड से कोई दिक्कत नहीं है।
अच्छा, और जब ये जो वाटरिंग और रेडनेस होती है वो एट द पीक ऑफ पेन होता है कि कब होता है?
पेन जब आता है तो
İndiyada bir katta balansaga davlat bansiga ishlaydi. Lekin dori-darmonlar topmadi. Tur so'rab dorilashdi, yaxshi bo'lib ketdi.
दो एपिसोड्स के बीच में पेन रहता है उधर कि नहीं रहता?
दो एपिसोड के बीच में पेन बिल्कुल चला जाता है, इवन आंखें जो लाल होती है वो भी ठीक हो जाता है।
अच्छा, जब ये एपिसोड होता है 30-40 सेकंड्स का उस दौरान,
so he was referred as a headache on the left side along with some watering, not getting relieved,
क्या बेचैन हो,
seen lots of people.
एक तो उस समय बढ़ता है, दूसरा स्ट्रेसफुल सिचुएशन में कभी अगर है तो उसमें दर्द बढ़ती है, और तीसरा
so this I had seen him before going to Canada. Now I've been following him up for 4 years. I got lucky with a good response to lamotrigine, so it was a TAC, trigeminal autonomic cephalgia. And this is my last slide. Unfortunately, I do not have his video. Maybe you can recognize one of your colleagues. He had come, probably my first patient in Fortis, inability to walk, wheelchair bound, and within last 1 year, could not walk even a single step. So he was given IVIG. So it was a case of a nerve problem, which we call CIDP. And now he is independent. I've seen him after 6-9 months, and he is walking without support. So sometimes right diagnosis and right treatment can do make a lot of changes. Thank you. If anyone has any questions, any comments, I'm happy to take them.
Surgery is one part. Of course, good surgery is important, but more important is preoperative and postoperative workup of the patient and the management of the patient. and that is where a good, well-trained neurologist role comes in. So that is why I wanted Dr. Saurabh to be introduced to all of you. He is a fantastic neurologist. He was trained especially in movement disorders in Canada, and he has been taking care of my patient, and he has done a fantastic job. That's what I wanted to say.